Hey Austin, Dr. Leeman here. Happy Monday. We are back with another patient success story. I've actually known this patient for many, many years. I've helped her with some other things with her voice box. Yes. But recently she was having more issues in the nasal region and kind of a lot of post-nasal drip, a lot of congestion and coughing. And you kind of came in and we kind of looked at a few things. We tried some sprays, really didn't give us the relief I was looking for, right?
Right.
And then what happened after that?
I had an inhaler that was helping me with a cough. And I really came in because I wanted Dr. Leeman to give me more drugs.
More medicine.
And he said, hey, Miss Henry, it's time to move on and do a surgery.
That's
and
right.
I was like, no. And then he explained that I'm having difficulty breathing is because I have a deviated septum. I have swollen or enlarged turbinates. And I'm just thinking, well, is there something else we can do to make it go down? And why do we have to cut it?
Yes.
But he explained I was going to feel so much better after the surgery. And even in the pandemic, ladies and gentlemen, I went ahead and said, okay, I'm suffering. I'm having bronchitis. I'm not sleeping. So I agreed to do the surgery. I'm breathing so much better. And I am having some drainage, but I'm still healing.
Yeah.
So I'm feeling really, really happy that I made the decision. And I'm looking forward to being on the other end of this thing.
And she's getting there quickly. So the procedure we did was actually a multi-step procedure. We did what's called a turbinate reduction. The turbinates are like the radiator of their nose. As you breathe in, they warm, humidify the air. But yours had gotten so big, so enlarged that they were blocking the airflow. Yes. In addition, she had a lot of drainage, and we actually treated her with this procedure here called cryotherapy. It's called Clarifix. But basically there's inflammation, or this nerve activity is very much prominent. After we do the freezing, so we take something that's very active and dripping and dry it out, which she's in the process of experiencing. She's only at, I think you're about 3 or 4 weeks out.
Right.
Already breathing much better. The drainage is less. She's going to continue to improve. So ladies and gentlemen out there, if you're suffering, yes, medication's only doing so much, please come in, see me. We'll have a consultation and we can do a pretty simple procedure. Talk about the procedure. I mean, really.
Oh, okay. The procedure was done here in the surgery center, so I didn't have to go to the hospital. Minimizes your risk of being exposed to other things. So I was very comfortably sedated. Real anesthesiology, people.
Yeah, yeah, of course.
I was like, a real anesthesiologist will be here.
Yes.
And Dr. Leeman said yes. And so I felt absolutely no pain. I didn't even feel pain in recovery. Yeah. I don't know what he did that I didn't have any pain, but I didn't have any pain recovering. Yeah. So it was a period of time of, yes, you won't be able to breathe very well out of your nose. There's a lot of care you have to take and make sure you don't damage the surgery. You do have to learn how to do a saline rinse. Rinse. Yes. I was really bad at it. But, I learned how to do it.
With time you get better, right?
Yeah.
Right. So with time you get better. And part of the reason why the technique that we use is very mucosal sparing. That's why she was not having much pain. There's a lot of nerve endings in the nose. But I'm trained in such a technique that we minimize that pain and discomfort. Wow. So if you're out there and you feel like pain and discomfort is putting you off from having a procedure, please come see me. Come see my technique. We'll be able to achieve some great results for y'all.
Yes.
So anyway, y'all be safe.
Yes.
And we'll see you soon.
Yeah, bye.
Bye.